Hello everyone, my name is Nicole Gervais and the case I'm presenting to the class is the case of the United States versus Dental Dreams LLC. First, I'll start with some background information. There are quite a few people involved in the case, so I'll review those individuals first, but moving forward, I'll refer to most of those people by their titles just in order to limit the number of names thrown out and to minimize any confusion. The first person I'll introduce is Dr. Jose Hernandez Gil, who is the whistleblower and the plaintiff in this case. Second, we have Dr. Noah Schaefer, who is the dentist accused of insurance fraud. Dr. Hernandez Gil took over Dr. Schaefer's caseload following his departure from the practice. Next, we have Dr. Samira Tasmain Hussain and Karam Hussain. Dr. Hussain is the owning dentist of the company, and when I refer to the company, I'm referring to Dental Dreams LLC. That company owns many offices, including Family Smiles, where Dr. Hernandez Gil and Dr. Schaefer worked. Her husband, Karam, is the company lawyer. He is also the president of KOS, which is the company that handles their financial administrative services for Dr. Hussein's practices. And together they own and control their large group of dental offices and the entire practice. Next, we have Edith Pinto, who is the regional manager. And finally, we have Clint Sandoval, the office manager. This case is interesting to me because there are two kind of major injustices involved. I'll start with the issues involving insurance fraud. So to review, Dental Dreams is the owning company of many dental practices, including Family Smiles, located in New Mexico. This is the office that Dr. Schaefer and Dr. Hernandez Gil worked at and treated patients. In May of 2013, Dr. Hernandez Gil began his very brief employment taking over the care of Dr. Schaefer's patients. He immediately noticed discrepancies between what had been billed and what treatment had actually been completed. He immediately alerted the regional manager, who initially acted surprised to hear of this. However, when he talked to the office manager claimed that the whole practice, including the regional manager, the company owners, and many of the employees were aware of these issues, and that a lot of these issues were kind of the norm within the practice. The office manager also claimed that the owners did not want to do a full audit due to the financial cost of an audit. The regional manager and the office manager instructed Dr. Hernandez Gil to complete any work that had been billed but not completed, and then fill out a form in order to credit his production and document the cases where this had occurred. It's also important to note that many dentists who worked for the company complained about difficult production goals and quotas, and they were put in place in order to fulfill employment obligations and in order to complete their contracts or in order to terminate their contracts early. It was implied by the office manager and other dentists that the billing errors were not an anomaly and that this was kind of the norm and the culture in the practice. So we'll get back to some of the issues with insurance fraud and faulty medical records, but I'm going to shift over to our second issue with the case, which involves Dr. Hernandez Gil's employment and his alleged mistreatment and discrimination. As mentioned, Dr. Hernandez Gil began reporting these issues and immediately noticed a change in his performance feedback. He also claimed that once the office manager discovered that his sexual orientation, that the office manager began inappropriately touching Dr. Hernandez Gil despite his request to stop. During this time, Dr. Hernandez Gil was also diagnosed with generalized anxiety disorder, and his doctor prescribed the use of a service dog for his panic attacks. His doctor had submitted the necessary forms, and Dr. Hernandez Gil began using his service dog, Bosco. An important detail to note is that Bosco was still in training and had not completed his certification. So Dr. Hernandez Gil discussed his accommodations for Bosco with the office manager and the regional manager. Since Bosco would be used to help during his panic attacks, Dr. Hernandez Gil requested to keep Bosco in eyesight and in an office that he believed was rarely used. The regional manager had requested that Bosco be created while he was in the office, but Dr. Hernandez Gil explained how that would defeat the purpose of having Bosco with him. The regional manager tabled this and said they could discuss this further in the future since it would be occurring in the future. Dr. Hernandez started bringing Bosco into the office, but did not create him. The next day, the office manager needed to use that office that Bosco was in for a meeting, and he had that meeting with the company lawyer. This alerted the lawyer that there was a dog in the office, which he was very unhappy with. He requested to talk to Dr. Hernandez-Gill and instructed him that companion animals were not permitted in the office and that there was a strict no pets policy. Dr. Hernandez-Gill explained that Bosco was a service animal and that he had documentation to prove that. The lawyer insisted that Bosco be left at home, and if not, Dr. Hernandez would be fired. So immediately, Dr. Hernandez tried to fight that and said that Bosco would be coming in with him and that he had the documentation in order to prove that. The lawyer then replied, "Fine, then you're fired." So again, it's a very interesting case. We have kind of two major issues at hand. Some of the legal issues addressed in this claim were of insurance fraud, which violate the False Claims Act, New Mexico Fraud Against Taxpayers Act, and the New Mexico Medicaid False Claims Act. Secondly, we have to review if Dr. Hernandez did experience any type of discrimination, wrongful termination, or mistreatment. With this part of the case, we review the Americans with Disability Act and Title VII, which addresses employment discrimination. So next I'm going to jump into some of the findings. Dr. Hernandez-Gill brought in Dr. Ryan Moffitt, a board-certified pediatric dentist, to review Dr. Schaefer's charts. He alleged that out of the 1,325 patient charts he reviewed, there were 324 patients who had had some type of insurance discrepancy or billing discrepancy. He further categorized these findings into two categories. The first one is that are patients who had had fillings billed out but that weren't completed. And the second category is patients who had had a type of restoration called a sealant done but were billed out for more expensive restorations such as fillings. So to give you a little bit of background, sealants are typically done preventatively in order to protect the biting surface of a tooth. They can also be done for patients who are starting to experience the beginning of decaying or staining. And staining is not to say like from drinking red wine and coffee. Staining occurs when the bacteria in our mouth start to eat the sugars that are located on our teeth or found on our teeth and start to produce acid. This acid wears away the enamel and leads to, eventually cavities, but in the meantime, it leads to staining. So even these teeth can have sealants done. It's still a preventative measure, but it's very obvious the difference between a sealant and a filling. And so in this case, Dr. Schaefer had been billing out these sealants, had been filling out these fillings, but had been doing sealants for these patients. To give you a little bit of financial background, sealants are typically less than $100 per tooth, and that's kind of on a high side, while fillings are typically more than $100, and that's kind of on the low side for the financial part. So Dr. Moffitt estimated that the company acquired approximately $91,251 in reimbursement from these cases. So, as discussed in previous cases or classes and discussions, the burden of proof in FCA claims lies with the moving party. The plaintiff must establish that the defendant knowingly committed the fraud. Dr. Schaefer testified that he was not aware of any fraudulent billing and that he would not have performed any necessary treatment on any of his patients. So for that reason, they did not believe there was enough proof to move forward into a trial because of the lack of proof. Regarding some of the issues involving Dr. Hernandez-Gill's employment, there was discussion about Bosco's legitimacy as a service dog. Since he was still in training and not certified, there was a valid argument that he was a companion animal or a pet and not a service animal. They also determined that Dr. Hernandez-Gill's responsibility to propose alternative accommodations for Bosco, it was his responsibility, and since he did not continue the discussion about creating Bosco or come up with new solutions while Bosco was in the office, he did not meet that requirement. It was also suggested that his termination had been in retaliation of his reporting the billing discrepancies that he was finding, but it was also determined that the company lawyer was not aware of these issues and these cases. So at the time of him firing Dr. Hernandez-Gill, it was not in retaliation. So for these reasons, a lot of the allegations of wrongful termination, discrimination, and retaliation were also not supported. What interested me in this case is that it had an obvious connection to our discussion about insurance fraud in our class. Personally, I've been working in dentistry since I graduated from college. Most of that time I've spent managing offices, and currently I manage a general dentist office here in Portland and handle a lot of the insurance responsibilities. I spend a large portion of my day dealing with the challenges of insurance and navigating billing rules and regulations. Additionally, with managing comes HR type responsibilities. I spend a lot of my day navigating employee regulations and mitigating conflicts in the office. So for those reasons, I found this case very interesting personally. So to conclude my final thoughts on the case, my first question is about Dr. Hernandez's case, and was it strong enough? Did he make the best strategic case in order to win the situation? In my opinion, I find it difficult to believe that Dr. Schaefer was unaware of his misconduct. Again, the billing is pretty obvious and the treatment is pretty obvious, the discrepancy between a sealant and a filling. So, and on top of that, most providers are either paid or bonused based on their productions for the day, production numbers for the day. So I find it kind of hard to believe that he wasn't aware of the issues with his billing, and there was kind of a motive for his personal gain. So for those reasons, I'm kind of skeptical that he was not aware of his misconduct. However, the burden of proof did fall on the United States to establish that he knew of these issues. It's unclear who testified in this case, but based off of the manager's comments, he implied that many people in the office knew about these issues. So I just kind of wonder, were any of these people questioned during the questioning phase of this trial or this case, and would their testimony have strengthened the case against Dr. Schaefer? It's hard to know if justice was truly served regarding these fraud allegations, because again, I really do think that it's very easy to discern the difference between a filling and a sealant, and especially a treatment that's just not done. So lastly, was Dr. Hernandez-Gill treated fairly during his employment and upon his termination? Did he experience discrimination and request reasonable accommodations for his disability? Additionally, was there any bias towards him since he did report these fraudulent billing practices? Again, it wasn't really determined, or it was decided that the lawyer wasn't aware of these practice issues and that he was reporting them, but it did affect his coworkers and his manager's view of him. So, these things can create bias, and his accommodations might have been more welcome, or people might have been more understanding towards what he was requesting had he not been reporting these issues. So I do think there might have been a bias towards him overall. Again, it's hard to say if justice was served legally. I can understand the decisions that they made, but it's hard to say if he was treated in a just and fair way either, especially from a manager's perspective. So again, just a very interesting case, and I really appreciated both the insurance part and the health and justice, but also kind of the HR and manager issues at play as well. So that is the case of the United States versus Dental Dreams, LLC. Thank you for listening along to my presentation, and I look forward to the discussions regarding this case. Thank you so much.